So this is going to be our newest video, and this is the one I promised a few days ago about non-degenerative dementia that can actually be cured. We're going to look at this graph here, I guess you can call it, from the Dementia Society. And we will also look at something from the diabetic community, because the vascular dementia or diabetes type 3 is different. That's basically degenerative and maybe not curable, right? So normally we have the normal aging process, which is here. And we will have some mild changes in our memory, our language, or our executive function. You know, when you get up over 80, for some people it gets a little more difficult to manage their finances, for example, right? Maybe they have a hard time managing their medications, like how much insulin to take and how much food to eat and in what quantities, based on what activities and what mood, and, you know, all the variables taken into account. So, you know, they will start to have some mild changes. When they get to have mild cognitive impairment, or MCI, this is when they start to have significant changes, but generally only in one of the three areas. And later on you'll see different medical communities use slightly different metrics for measurement here, but they all basically boil down to the same thing, which are memory, language, and executive function. So in this case here, with mild cognitive impairment, you would have a significant change in one or the other. And you would also have, so then, when you head into the dementia, that's when you have significant changes in all. See, over here, mild cognitive impairment, it's or. Dementia, it's memory problem significant, plus language problem significant, plus executive function problem significant. So it also goes into things like your basic activities of daily living, BADL. So for example, if you can still wash yourself, if you can still clean your apartment, if your hygiene is good, you can dress yourself, you can feed yourself, you can go to the washroom by yourself and clean yourself and everything, then your basic activities of daily living are okay. And in that case, you should really be able to live with some sort of assisted living. If you can't bathe yourself, if you can't eat yourself, feed yourself, you know, if you can't look after your basic toiletries, then you may need some more care than that. But basically, the good news is that this is, if it's not vascular dementia type 3, which if it's just mild cognitive impairment, up to 38% will return to setback, let's call it a setback or challenge, levels for their age. So you're going to see that coming up in a little while, and you can see right here that people get better. Okay, you can see it right there. Once you cross over and go too far, there's no more really getting better anymore, but you can still slow it down, I believe. So, but you can get better. You can see it right here. And in Grace's case, I don't think she even has dementia, because her basic activities of daily living, she's fantastic. And her executive function is fantastic if you are patient and have time. Her language skills are exemplary. Just short-term memory problem, which affects her IADLs, which are her instrumental activities of daily living, like taking her medications and everything. So now, just to move on, I'm going to actually jump right down to this page here, because we were just talking about diabetes and memory loss. So uncontrolled diabetes may increase the risk of experiencing cognitive problems such as memory loss. What happens is it builds up in your vascular system, so you'll end up with vascular disease in your heart. People have limbs removed. The brain gets, the small capillaries get plugged. So sugar, 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 no good, no good, no good. Diabetes, too much medication, too much sugar, no good. So just to quickly go over this, diabetes type 3, it is 30% of strokes. It's the leading cause of blindness. It's 40% of heart attacks. It's 50% of kidney failure requiring dialysis. And it's 70% of all non-traumatic foot amputations. End-stage renal disease, cardiovascular disease. So we spend $75 million a day in this country on diabetes alone. And it is, diabetes type 3 is now considered to be vascular, it's dementia. It's dementia. So now we're going to go down, we're going to look at this here. This is the Cleveland Clinic. They have locations in Abu Dhabi, Canada, Florida, London, Nevada, Ohio. There's other locations as well. It's basically a worldwide medical community, I guess you could say. And before we go much further, I'm going to go to the very bottom because I'm going to show you that it was last reviewed 2023, right? They give the month first, so that would be May 9th, 2023, approximately a year ago it was peer reviewed. And so I'm going to go back to the first, and I'm kind of going to be a little bit quick going through this too because I don't want to get caught in the weeds. I want to make it easy for you. So mild cognitive impairment has several possible causes, some of which are treatable. See that? Some of which are treatable. This is another medical resource telling us that mild cognitive impairment is treatable. Doesn't have to become dementia. Does not have to become dementia. Usually with your memory, reasoning, see, planning and completing complex tasks. And then we come down here. As you age beyond 65 years, you may occasionally forget names and words and misplace things. I was doing that when I was 30. With my, just joking, but you know, there's truth to that, right? Have you ever heard the phrase, I'm so poor I can't pay attention? That's because stress will do the same thing. And actually, I have a back injury that could cause me with hypertension to be the same thing. So it says with mild cognitive impairment, you frequently forget conversations and information that you would typically remember, like appointments and other planned events. MCI interferes with your daily routine activities. For example, even taking public transit. That's an instrumental activity of daily living, right? Maybe you can't take the transit, right? But as we've shown, you can get better. Or, you know, you can get back to normal for your age. But that doesn't mean 80-year-old or 85-year-old people should all be running around on the bus. So then what's the difference between dementia and mild cognitive impairment? Oh, I got to make sure that's on my camera here. Says mild cognitive impairment doesn't interfere with daily living, whereas dementia does. But I kind of, I think mild cognitive impairment does, because if you just simply have a memory problem, how are you going to be able to deal with your instrumental activities of daily living? All the basics are there, but the instrumental parts aren't. So I'm not really sure if that's dementia or not. It might still be able to be cured. But down here it talks about, again, memory, language. It also talks about mood and coordination, but that's diabetic stuff too. Let's just skip down. Here we go. Some people with MCI eventually develop dementia, but others don't. So you see, that's the point. So for certain neurodegenerative conditions, MCI can be an early stage of the condition. So that could be several forms of Alzheimer's, Lewy body, I believe, although I'm not a doctor, I don't know at all really. But I do know that it can be a sign, or early onset sign of vascular dementia. This is where it comes from, the sugars, right, and the diabetes. And neurodegenerative conditions affect your brain and get worse over time. Alzheimer's disease and Parkinson's disease are examples of this. Those are neurodegenerative disease. Some people with MCI return to normal cognition for their age or remain stable. It's actually up to 38%. And the number that gets worse is somewhere around 15%. We're going to see that coming up. So it does not have to go into dementia. Some people with MCI return to normal condition for their age and remain stable. Remember for your age too. Very, very important. How common is mild cognitive impairment? 75 to 79, 15% of the people. Once you get 80 and over, it's 25%. So it's quite a number of people that have mild cognitive impairment, actually, if you can see the numbers here. And these are the people that really should not be in nursing homes necessarily, because their basic daily activities of daily living are fine. They can do everything, go and enjoy life to the fullest, the food, everything. But if you put them in a nursing home, they have too much energy, it doesn't work. I think about 25% of the people in nursing homes with dementia that are getting antipsychotic drugs fall into this category. They don't really have dementia. They have mild cognitive impairment. And then due to the stress and everything in the hospital, they will develop dementia for sure. It's, they lose hope, they give up. So what are the symptoms and causes of mild cognitive impairment? The main symptoms: memory loss, language, attention, so you can't focus, right? Reasoning and judgment, and complex planning. We basically try to think of the three: the language, the memory, and the executive function, because reasoning and judgment and complex planning are part of the executive function. So is the attention, but you might want to throw the attention in as something to pay attention to. There you go. Then there's also movement difficulties and problem with sense of smell. So once you start to have moving difficulties and everything, then that's considered functional decline. As long as your basic activities of daily living are not affected, then you do not really have functional decline. And then we're going to see here, mild cognitive impairment, MCI, can have several possible causes. Some are treatable and others aren't. So sometimes you will go into dementia and sometimes you won't. But look at this. This stuff is all curable. Depression, chronic stress, anxiety. And actually the fourth one in another chart I saw was not sleeping properly, which comes from depression, chronic stress, and anxiety. Some people actually feel that home care can cause this with the improper care, because they don't have in place this assisted living that 20 to 25% of the people need. And then there's kidney and liver problems as well, which come along with the diabetes. And then there is so sleep apnea, sleep disorders, traumatic stroke. It can even be vitamins sometimes. You got to be very careful. But mostly, it's depression, chronic stress, and anxiety. You need to exercise. You need to eat right. You need to have social interaction. You need to have some cognitive challenge. And keep an eye on your heart, because we're talking about vascular conditions here possibly too, right? But you can cure it. Hope molecule. If you go for a walk and you're happy, whistle while you work, you will be producing hope molecules. You'll have a reason to live. Your brain will become active. If you sit on the sofa and, I can't get my money, and I can't get any help, and oh my goodness, then you're going to have depression, chronic stress, anxiety, sleeping disorders, and you're going to start, your memory will start to fail, because you'll basically be giving up. Remember the hope molecule. Sing a song, make it happy to last your whole life long, and sing. Okay, so here it says MCI is often an early stage of certain neurodegenerative, right? MCI can be non-degenerative, and people can get cured or return to their normal cognition level for their age, or it can be a sign of other things, like vascular dementia, for example, which comes from diabetes. This happens when the capillaries, I guess, in your brain, much like in your heart, causes heart disease, causes limb amputations because of the veins fill with sugars, right? That's what happens. So we got to be careful. Vascular dementia is maybe not curable, but I'm sure you could arrest it. You could stop it and pause and slow it down. With Grace, for example, she had diabetic retinopathy and was going blind, but we not only stopped it, we reversed it, and it hasn't come back. She no longer needs eyeglasses for daily wear, only for reading. So the highest risk factors for cognitive impairment are the same as those for dementia. See, because cognitive impairment is on the step. It's on the way to dementia. So Grace's doctor has been spectacular. We know that she has cardiovascular disease, as do I. And her doctor's really, really good at helping us maintain her blood pressure within reason, which is amazing. And Grace also has diabetes, and she used to be a beast when I met her. We now have her in the prime body mass index for herself. So, but the diabetes and the obesity, the high blood pressure, right, they're going to cause the cardiovascular disease. And they're going to cause your dementia. Because if you don't stop the sugar from blocking up the nerves, from blocking the blood cells, then you're going to get worse and worse. You can go look at this yourself if you want to on the website, Cleveland Clinic. And then imaging tests, which Grace did have, which is the best way to tell. An MRI, they look for evidence of brain damage. So in Grace's case, nil acute, no change. She does not have vascular dementia. She had a test this year and last year. And then down here is management and treatment. Can you prevent it? Not all cases are preventable, but here are steps you can take to try to keep your brain healthy and reduce your risk of MCI. Don't smoke. Don't drink. Oh my goodness, I didn't know it, but drinking alcohol, I'm so happy I quit. It causes something called mush brain. It absolutely, just like diabetes, will destroy your brain. So the finger method is to eat regularly, exercise regularly, look after your blood sugar in this. It's also mental challenge or cognitive challenge and socialization. That would be the finger method to help with dementia. But then the other method these guys have is to manage the stress, get the quality sleep, right? Which I knew from the very beginning. These are just basics of living. These are just the basics, right? Manage your stress, get the right sleep, manage your blood sugar. These are all things that I do. Exercise regularly, eat a healthy, balanced diet, right? These are all things I do for Grace every day. Trying to do some puzzles, not really into it so much. Make sure you engage in social activities. Get out in your neighborhood, get to meet some of the people. You know, there's summertime, there's always lots going on. Must a prognosis for mild cognitive decline? Here it is. Studies show that about 15% develop dementia within 2 years. That's only 15%. They also show that 14 to 38% of people with MCI return to their normal level. So 15% got worse and 14 to 38% got better. The rest remain the same, right? So that's really, 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 really amazing. You can get better. And if it's diabetic, you can stop it by controlling your glucose levels. Stay below 12. When you go above 12, you cause damage. And if you're using the Libra, it's usually off. Like, I can't check yourself, do a blood test, and check your Libra at the same time so you can check the measurement, because don't think that you're over 12 just because one test shows it. You must calibrate your equipment, it's called, right? So the rate of decline in someone with mild cognitive impairment often depends on the underlying cause. So if it's depression, chronic stress, anxiety, not sleeping, maybe because you're not getting the right health care you need, or people are withholding your money, or challenging your ideas and dismissing them, right? Or guilting you, bad, or isolating you. These are all signs, those are signs of abuse, actually. So how do you live with it? How do I take care of myself? We just went through all that with all the talking and everything, but it does say here that you should have preparing documents to legal issues, so you should write some powers of attorney if you have MCI, because if it is an early stage of a neurodegenerative condition, you will need it later, okay? What questions may I ask my provider about my MCI? What caused it? What caused it? I think in Grace's case, it was originally the sugar, but, what management options do I have? We've been trying to find that out for 2.5 years. Will I develop dementia? Not necessarily. How can I keep my brain healthy? So these are things, right? And there it is, last reviewed, 05/09/2023. So it is 100%, or at least 38% of the people get better. And it depends on, can you, according to the finger method, it's diet, exercise, cognitive challenge, socialization, and keep the blood pressure down. We also know that we need to manage the stress level. We need to manage the anxiety. We need to help the person not become depressed. And the best way to do that is to treat them like a normal person, include them in activities, keep them busy with their socialization, and with the hope molecules. You can look up hope molecules too. They actually help your brain come to life and say, hey, I want to be alive. It's that simple. And you also need to sleep properly. Very, very, very important to get the right amount of sleep, because that's when your brain organizes your thoughts from the day before and repairs itself. So I was going to talk with Grace, but she seems to have fallen asleep. You can see my Bowflex. Oh, you're awake, Grace?
Yes.
Okay. I thought she was sleeping, but apparently not.
Yeah.
So I'm going to go over and have a little chat with Grace.
Okay.
See how she's doing. I'll open the curtain here, okay? You guys know me and Grace. We've been friends for 2.5 years now, right, Grace?
Yes.
And I just talked about the mild cognitive impairment and the dementia and everything, and how people can get well.
Okay. I agree with you.
You agree with me, right? You know yourself, sometimes you get better than others, right?
Occasionally.
Yeah. Like when you take the drops I give you, you said to me one time a long time ago, I'm getting worse, Mark. What's the problem? And I said, you stopped taking the drops, Grace. And you said, yes, I did. Do you remember that?
Yeah, I remember the conversation.
And then you started taking them again, and you know now that they work, right?
I'm a human being with emotion sometimes.
Yeah, but do the drops work?
Yes,
They do, right?
expensive.
Well, they're not that expensive. Don't worry about it. You're not really paying for them.
But you pay for it.
That's okay. It's all right. It's part of the process, right? Part of what we're doing. But so your memory is getting better lately. As a matter of fact, let's remember this one. You went to the hospital recently, and the people came in to do a scan on your brain, right?
Yes.
And when you walked into the room, what happened?
They recognize me.
Did you?
You mean the latest one, right?
Yeah.
Yeah, they recognized me some time ago when the new machine was purchased by the hospital. I am the first customer. And when they started with the new machine, we have fun in learning the machine and doing and do good tests on me.
That was the first time last year, and then this time it was the same people, right?
Yes, same group.
And did you recognize them?
They recognize me too.
Yeah, I know they recognize you, but did you recognize them?
Yes, I do.
Because I'm trying to get to your memory, right? You recognize the machine and the people, right?
Oh, yes. Because it's a very sophisticated machine.
And they were very happy after the test.
Yes.
Same machine both times.
And yes,
same people both times.
We at least we both remember the fun and the pain of the first test. Now we enjoy and really more confident. They were happy with my result.
Yeah, they were happy with your result. I'm pretty sure that somebody said no change, and then somebody else said what? Somebody else said what?
Good.
Even better, I think you told me.
Yes.
And now we have a bit of the result where they say nil acute, which means no change. Not even aging change. Certainly no vascular dementia change.
Yes.
Very, very good. And you have no basic activity of life decline, like you shower by yourself.
Of course.
You can do anything that physically, like dress yourself, feed yourself, go to the washroom. You even go shopping a little bit by yourself and go around the neighborhood walking by yourself, right?
Yes, I am very independent.
You have no physical function. Good for you. You have no physical functional decline. You're in better physical condition than when I met you, right?
But I still enjoy companion very much.
I know that. But you're in better physical condition than when I met you, aren't you?
Yes.
Much better, right? Before you were obese and
I'm
walking
happy.
with a cane and hurting yourself and going to the doctor. Now you're tough as nails.
Yeah, you look after every aspect more than myself.
Well, I don't look after I don't look after your basics, but I look after your instrumental. I look after creating your diet plan. I look after creating your exercise plan. I look at your purchasing your groceries.
You do not just look after. You explain to me the requirement, the standard, so at least I know where I'm short of. I'm so happy to have your guidance to help me to get better, not just back normal. I want better. As you know, my standard is huge. So the doctors know that my personal standards are very high for my own self and also for people.
And we want to help a lot of people. We want to help home care because we think people like you can't live on your own, but you shouldn't be in a nursing home either because you have too much energy and too much to offer the community. We think people like you should live with a family, don't we, Grace?
I can disagree with you.
Like with an elderly coach, right?
Yes.
Beautiful. Very,
Thank you
very
for your
good.
help.
Yeah, we're having a great day. We're doing a great job. You're getting better and better, Grace. Bye-bye.
Bye-bye.